So therapy is an important part of this. Community is an important part of this. But specifically about therapy, I mean, there does seem like coming out of COVID, there was this sort of coupling. I mean, maybe it's always been like this. You tell me. But with the pharmaceutical and get a therapist. But like I hear people talking in therapist languages, like in therapist language nonstop right now, and it is like it's almost like kind of getting annoying that everyone is speaking in this like therapy lingo vernacular. Is therapy the right? It sounds like therapy could be the right option potentially, depending on who it is. Is that the right way? Um, and there's also bad therapy out there.
Yeah, I hate that therapy lingo, that therapy speak. I mean, I get a strong like vomit reaction to it. Like it's so inauthentic, right? And
Yeah,
it's so like rehearsed. And you see, it's like these therapists are coming off the assembly line, trained the same pop culture nonsense over and over and over again, and you're embedding all these ideas, and it's certainly this like level of brainwashing to an extent I could have never predicted in my field. All right, so psychotherapy, like anything, it's a way of intervening with somebody, and there's time and there's place and there's conditions and there's ways in which it can yield a positive effect and really help people, and in the same regard it can create harm. So first of all, I believe most people shouldn't be in therapy, right? I think it should be for a select few of people who are really stuck. They might and don't know how to get out of it. um, they might not have the awareness of how to get. They're in a lot of pain. They're responding automatically. There are some like conditions, right? Like that are really real. Like we put these labels on it, but post-traumatic stress disorder is a very legitimate and debilitating condition. People can get horribly depressed. Fear can consume people. Obsessive compulsive disorder can be really, really impairing. People can get stuck in their minds, become obsessive, and develop patterns of relating to that fear over and over again. I work with people who are bulimic. I work with people who certainly are in the aftermath of some traumatic incidents, and they're consumed by the memory and the fear of that. So, certainly there's like some real established ways of like working with people that are well studied and well versed, and there are experts in delivering that, and I think that can be effective. They tend to be much more short term than what we talk about in our culture. You hear this like people are going to therapies for like years. They're high functioning, and it's like they run every problem by their therapist, as if
yeah,
it's become a pseudo friendship, and like it has to be run by them for like permission on how to like make major decisions in their life. And my
right.
personal belief on that kind of stuff is it undermines their own autonomy, right? And that's just creating dependency. That's not facilitating somebody's like natural abilities to face life and seeing them as a resilient being and capable of amazing things. No, that's like creating an environment where you can get income every week.
Hmm.
So I'm concerned about that. The other thing I'm concerned about with modern therapy and therapists, which a lot of them I feel like they're younger now. They're not really trained with a lot of depth. They're kind of
Hmm.
pushed into this model of diagnosis and a talk therapy, and what they're exposed to on like TikTok. Like I literally hear like young therapists who we're interviewing, they're like using terms that are like pushed on TikTok or by influencers. Like so cultural lexicon about what people are kind of going through. Like I hate that like my anxiety or my ADHD, like it's like
Hmm.
something you own, right? Like
That's
it's
so weird. That bothers me so much when people do that.
yeah, I mean, it's like my trauma or my trauma is preventing me from doing this, or every reaction, like all this overanalyzation of every little experience that goes on in your mind and your
Hmm.
emotions has to be somehow like verbalized to everybody. And I say like where your attention goes, your energy is going to flow. I just put something out on Twitter. um, I think focusing on your mental health is harmful. Do people know what I'm talking about? And I got some of the best responses. Yes, I know
Hmm.
what you're talking about. Because the people who are doing well in life, they know that their attention needs to be focused on the things that are most meaningful, right? So they're generally serving others, or there's something that they're passionate about, and they're focused in out of life. When people are focused in on themselves all the time, it tends to drive misery. And the thing about bad therapy is that you can collectively, a therapist and a client, create a reality together. That reality could break up marriages. That reality can victimize you. Because, the one thing that you have to be humble about as a therapist or psychologist is you're hearing somebody's story, their carefully constructed story about their own life. And it's filtered. They're picking and choosing what they're going to be sharing with you. And,
Sure.
and poor therapists take everything that is said as if it's gospel and then respond to it and create another narrative around it. And before you know it, you got more and more people living in their own heads, which is the opposite of living well. And that's what we've created in modern therapy culture, and like we'll have people call in, and certainly it's been intensified post COVID. Like, I
Yeah.
mean, for a while there, we had like a waiting list of like 500 people we'd never get to because so many people were seeking out therapy. And I just developed a way of like screening through all those people who, just want to do therapy because it's popular or because their friend is doing it. And
Right.
so, um, the ideas that can be created in that therapy can be really problematic.
Mm-hmm.
And the you're pulling people into their own minds. We talked about like this rumination process that you can get people to repeat their past over and over again and get stuck on. And now you're like in this cycle of like creating this idea of yourself, and you're experiencing all those negative emotions that are generated from focusing only on the problems that exist in your life, because we've been kind of convinced through like Talkspace and all these other apps, which again, they're businesses, they're trying to get you on their platform,
Right.
that just talking about your problems is like the most effective way to achieve sound mental health. And that's not true. That's a lie. Sometimes focusing on your problems is the worst thing that you can do in your life. Now, that doesn't mean that there are some situations where you get stuck or some things in your past you have to move on. But like, listen, that's not the way it is now. People think I need to talk about every single problem, and that's where I'm going to feel better. And, there's so many times that I'm in a position where I have to tell somebody, you don't need therapy. This isn't the right path for you.
Wow.
You're doing
Yeah.
okay. And people never hear that because like, again, this is the business of it. And
Yeah.
there's a book out called Bad Therapy. Abigail Schreier wrote it.
Yeah.
And she interviewed me, and I have a couple quotes in there. But one of the things when I had my conversation with her is, I'm spending a lot of time telling people you don't need therapy, right? You're better served by focusing in on other things in your life that are really meaningful and passionate. And some people get offended by it, right? Yeah. Like I think everyone should have therapy.
Yeah.
You're depriving me of something, special. You're going to have to tell people, this can be a harmful process for you.
Yeah. And I mean, I that's funny that you were in that book, by the way. I read that book, and maybe around the same time, maybe like the AI Instagram world we're in fed your feed directly into mine. So like we've also got this at play too, don't forget. But so there, it's possible that this could be a route potentially for the right person in the right moment.
Of course.
But for the vast majority of people, you've mentioned these words, resiliency, courage. And so if we could land the plane, like how do we become a more resilient person, a more courageous person? And are even those the two like main words you'd use? Like what are those words? What are those characteristics we can pursue, and how do we get those? Or at least start the journey?
Yeah, I mean, it's a great question. And, first of all, I'm a big believer in family. And so, one of the things, I think we've turned into this expert culture in the United States where like parents don't even trust themselves anymore. And they're getting things off of like some expert or some, media member who's like promoting this new idea about the best way to raise your kids or the best way to do these things. And really, people become paralyzed in fear. And one of the things I have to share with parents, there are parents who seek out consultation for me all the time. And some of the messages that I'm giving to them, I said, nobody knows what's, best for your kid than you. Like it's in your heart. Love is the manner. And let's if you were going to make a loving decision here, right, for the long-term well-being of your kid, what decision you would make? And 99% of the time people come to the right I think, the right answer. So here's what I would do. First of all, I would abandon public schools discussion of mental health. Like, they would not be able to discuss it, right?
Good.
Because they're toxic and poisonous ideas, right? Now, would I have things about character, and would I have lessons on like resiliency and strength? Sure, I would. Would I normalize the range of human emotions that people have, like in a science class or a health class? Of course, I would do these things. But they're not in the business of mental health, right? They're not assessing, evaluating, or interacting or shaping a kid's idea about their potential or what they're going through or who they are or any disorder they may have or any doctor they see. They stay the hell out, right? That's my, you stay away. Now, we communicate, we get back to things in our society about, we normalize challenges and we focus on, how to respond to them. Okay. So when people stop turning inward and thinking that there's something broken within them because they feel sad or because they feel anxious, is when we're taking the steps towards resiliency. I was blessed with a father who said, "Yeah, that's hard. What are you going to do about it?" Right? Yeah, life is going to kick you down sometimes. How are you going to get back up? How are you going to respond to this situation? And if you respond to it like through avoidance or escape or fear, you want to take the easy way out? What do you think's going to happen when you take the easy way? So I got all these messages constantly, right?
Yeah.
That, first of all, struggle was normal. I would have never even, I knew that depression existed. First of all, I'm older, so I grew up in a time period where we didn't talk about this stuff. And it's not like, we all were, it was hidden from everybody, and the mental health outcomes were much worse. That's not true. That's like what this current generation wants to say, is that, like we've come out of the closet and we're speaking about mental health and we're helping people. No, we're creating a whole new reality, right?
Yeah.
I look back historically, I was looking back in like community-based samples in like the 1920s, 30s, and 40s. So you're talking about a time in United States history where there was the Great Depression, there was poverty, there was segregation, and there was war. And there was less than 1% of people would identify themselves being depressed in the past year. So you're saying, about 1% of the population would fall into what they would call melancholy, right? Or really struggle. Now it's like 1 in 5. So, you go from 1% to 20%. How does that happen? How are we doing better, right? Because we've cultivated this idea that anything that is emotionally painful means it's a medical condition, it's an episode. We got to get back to that language of suffering and like communicating that, articulating in ways that normalize it, and we build up our capacity to respond, to solve problems. And within that is this belief in who we are, right? That there's a spirit within us, and we are naturally designed to thrive. And that's a mindset, that's a belief system, right? That's not invalidating somebody. You can validate someone's pain and believe in their ability to respond to it and even get stronger through it. And that's going to serve that person well. But ultimately, listen, we want to improve people's health. You got to love people, right? If someone is truly loved, they're not abused, they're not hurt, they're not abandoned, they're not treated with an emotional distance where we don't feel connected to who they are. That's what I hate about our current mental health and medical system right now. Is you give them a prescription, you send it on your way. You're not attached to that person's outcome. When psychiatrists are interviewed about what would be the first thing that they do for themselves or their kids if they were depressed, they don't say, "I'm going to give them a drug."
No,
they don't. They don't. So how do you have to marginalize another person to see the only way that you can get better is by me getting you hooked on a pharmaceuticals? They all create dependence, right? What do you got to do in your mind to make that okay? So we are there's this illusion of separation, and the more distance we become from each other and you don't see God in the other person, well, then that's a path for doing harm. So you see God in everybody, and so love, seeing God in everybody, changing how our culture responds to struggle. Older people, right? The United States treats their elderly like shit, right?
Yeah.
They're the ones that you put in homes and you put on drugs when they're the ones who've lived the lives. They're the ones
Right.
who have the wisdom, right? And so we've taken that out of our culture too. When you can travel somewhere else, like, you know, to like Eastern cultures or indigenous cultures, and you revere the elderly because they are the most wise. They've been through it. They have to share the messages back to generations.
Mm-hmm.
So, you know, obviously we're creating a culture of fragility under the disguise of compassion. And what we need to do is build up a culture of strength under real compassion.
Well, who needs the elderly when you've got a 27-year-old TikTok doctor? I mean, we got everything solved, right? We're good.
True.